You talk about cancer as well a little bit earlier. It's another disease that continues to be a major issue. Where are we now in at least the learning process of how to fight that?
Well, I think we're doing much better with cancer in terms of its therapy because we've taken an approach which looks at subsets of particular cancers and identifies them as whether they're genetically driven or environmentally driven primarily. And now we can now tailor treatments for those specific patients. And that's where it's all headed. I think in the future we'll have very unique therapies for individual patients that are much more successful than we've ever seen before, because in the past therapies were developed in a more general sense. Pools of patients that had a given diagnostic handle, more or less, were given the same type of therapy and then compared to controls. And now we know that if you look at subsets of those patients, some do very well on this particular therapy and others don't do well at all. So now we're trying to subset out these patients to identify in advance patients that might do well with a particular type of therapy and treat those patients differently.